Hi, I'm Dr. Bruce Hillenberg, and I am a clinical psychologist, and I work at Beaumont Health, and my specialty is chronic pain, and I've been working in the chronic pain field for over 30 years, working with individuals who live with chronic pain on a daily basis, and also I'm involved in educating our residents, medical students, and physicians on the best approaches to helping patients with chronic pain, both using medical and psychological strategies to help people cope with their condition. And my talk today is on the behavioral aspects of chronic pain management. One of the things that is important for us to realize is chronic pain is a very common medical problem. We define chronic pain as having a pain problem that persists for 3 months or more. Now, it may persist on a daily basis or intermittently, but it lasts at least for 3 months or more. And many of the patients I see and work with have been living with chronic pain for many, many years. One of the things that we need to really be aware of is how big a problem chronic pain is. It's very, very frequent. In fact, it's probably one of the most frequent medical problems that physicians, whether in a family medicine office or in a specialty office, are treating. Recent research has shown that among children and adolescents, up to 20 to 25% have some type of chronic pain problem. And in fact, with children and adolescents, the most frequent chronic pain problems are headaches and chronic abdominal pain. And for many individuals, which we'll talk about, chronic pain can significantly interfere with enjoyment of life and their daily activities, as well as attending school or work. In addition, when we think of the adult population, the percentage of chronic pain increases. Recent research has indicated that anywhere between 37 to 41% of adults are experiencing either daily or intermittent chronic pain. Now, that's a very significant and large percentage of our population. And lastly, for older adults, 65 years or older, some of the statistics suggest that anywhere from 60 to 75% of individuals 65 and older are struggling with chronic pain conditions. So as we can see, it's a very common phenomena among our population. And an interesting fact is that when you look at the impact on society and health systems, that the impact on our healthcare cost, as well as on personal productivity and cost to society, that the total amount of impact from chronic pain is greater than the combined impact from obesity, heart disease, and cancer together. So it's a significant problem in our society. Let me talk a little bit about what causes chronic pain. And one of the critical issues is that with acute pain, which we all experience, injuries, twisted ankles, broken arms, most acute pain will resolve itself and heal itself within weeks to a few months, and the individual has no lingering effects on that. Whereas in chronic pain, whether there's been a specific injury or not, the pain problem just continues to persist. And historically, we used to think that the cause of the pain was directly related to the perhaps tissue damage or what specifically caused that. But we now realize that there are many factors that contribute together in an organic way in causing chronic pain and maintaining the chronic pain in an individual's life. So let me go over some of those factors. And we call this phenomena, it's called in the literature the pain matrix, the chronic pain matrix, the idea that there is no one location for pain. First of all, one of the factors we want to think about is what is the injury. So might this be a person had a surgery and for some reason after everything is healed up, pain persists? Or did they have a broken leg or a broken arm where things persist? Perhaps somebody's had a herniated disc in their back or their neck and pain persists. So one, we want to think about the underlying injury. Secondarily is genetics. And one of the things we found is that we're genetically predisposed for our pain system to be mildly, moderately, or severely reactive to underlying problems. So our genetics strongly influences the intensity and the duration of the chronic pain we may experience. Also, our nervous system is what we call plastic, which means that it grows and changes over time. And if you have constant pain being generated into the spinal cord and brain from an injury, those nerves can reprogram themselves, and the spinal cord and brain can reprogram themselves, become very sensitive, and that sensitivity can, in a way, persist with the pain. I'll give you a very good example. Some individuals have what we call phantom limb pain, where they will lose a leg from a traumatic injury, which was very painful. When that leg is gone, the pain receptors are gone, but they still may report persisting pain in what used to be that limb. And as a result of that, what's happened, the nervous system has reorganized itself in the spinal cord and brain and continues to generate pain messages even though the leg is no longer there. Another factor is also our emotional response. I always tell individuals that while pain is like fire, stress is like gasoline. And one of the things we know is that living with chronic pain is a very stressful, very frustrating experience. And our emotional reaction to that, especially if our emotional reaction is more negative, can generate all kinds of stress hormones and inflammatory chemicals in our body, which can increase and amplify and dial up the kind of pain that somebody experiences if they are having chronic pain. The last factor is physical fitness. Oftentimes, chronic pain, if you've experienced that, you know that it can really get in the way of exercise and some of the other daily activities that you'd like to engage in. One of the problems is that if we don't maintain a certain degree of exercise and physical fitness, our body can become deconditioned, lose its strength and its endurance, and as a result of that, our pain system actually becomes more hypersensitive over time the more we get out of shape, which is one of the biggest challenges for somebody with chronic pain, is to find that sweet spot in between, not doing too much to amplify things, but making sure they physically do enough to keep their body in shape and their pain receptors from becoming too hypersensitive. So let's talk a little bit about what coping is with pain. And my specialty, again, is individuals with chronic pain and chronic health problems. And one of the things I try to do as a psychologist is assist patients in their efforts and individuals in their efforts to become what we call survivors. That is, despite their chronic pain, despite their chronic health problem, they still can maintain a decent quality of life, positive self-esteem, and they really can still pursue the kinds of things they need to do on a daily basis to feel that life is worthwhile and meaningful to them. So let me talk about 3 of the things that I find from our patients that they do that really help them cope well with their pain. The first thing I find patients do, or individuals, is they find acceptance of the pain condition. They say, okay, if this is what it is, I'm going to find the best way I can of living with this. And also, we rarely in the medical field can cure pain. We can help dial it down a little bit, sometimes maybe 30% at most. So a lot of what we're doing is trying to help people live a full life despite their pain. And so when I find individuals accept that reality and start searching for ways that they can reinvent their life, they can find new ways of exercising and find new meaningful activities, that's the type of individual who I find reports that despite their pain, they're having a better life, and oftentimes they will experience some modest reduction in their pain awareness and sensitivity because they lower their stress level. The second thing patients or individuals do who are coping well with their pain is they stay plugged into life. They continue working. They continue going to school. If for some reason they can't work, then they reinvent themselves. They maybe do volunteer work. They find other physical activities that they can do which allow them to maintain their vitality, their endurance, and their range of motion. But they stay plugged into life, which is very critical, because we find that when individuals with chronic pain start unplugging from life, they're more prone to depression, anxiety, and significant unhappiness. Lastly, I find that individuals who are good survivors and living with chronic pain find a new, renewed sense of meaning and purpose in life. And for individuals who are struggling with chronic pain, which, as I said before, is very frequent, it can really interfere with some of the activities which are very important in a person's life. But what I find is that individuals who are good copers, they accept that reality and they find new ways of adding meaning and purpose in their life. They become really good at redecorating their life. And I'm not saying this is easy, because living with chronic pain is very difficult. But these are individuals who are very determined, have strong will, and refuse to give in to the persisting frustrations of the chronic pain condition. So let me talk in summary a little bit about how coping can help with chronic pain. First of all, as I mentioned before, the more stressed we are, the higher is our body's inflammation level. And the higher is our body's inflammation level, the more it's going to dial up and make worse chronic pain or any other health problem we have. Therefore, stress management, taking care of ourselves psychologically, learning how to take time out, and learning how to have a better quality of life is critical, because it will reduce body inflammation, which can directly lower and dial down the sensitivity of our pain system. Also, I find that individuals who dedicate themselves to more coping, positive coping, are more optimistic. That is, they can look into the future and say that when the future gets here, even though my chronic pain is difficult, I think I'm going to handle it. Because I've demonstrated to myself that I can handle it. Another thing is that optimism and good stress management leads people to find ways of exercising and moving and keeping your body in shape, which is very important. And all of this leads to a better quality of life, we say, despite pain. In fact, in our pain programs, when we have individuals start our pain programs, they will often say that their life is on hold, their activities and their enjoyment of life is on hold because of their pain. But when they leave our program, sometimes their pain is only better by maybe 20 or 30%, but despite that, they say that they're not letting the pain interfere with their enjoyment of life or with their quality of life. And that is, they've taken pain from the passenger seat in their life, from the driver's seat in their life, and they put that pain in the passenger seat. So the pain's still there, but because of their positive coping, they are kind of going in the direction they want to go in. And lastly, in our programs at Beaumont Health, we focus our treatments for chronic pain on three things. One is we try to reduce pain as much as we can through medication, treatments, and doing everything we possibly can do. But again, we can be helpful, but oftentimes we cannot cure that problem. So as a result of that, we all have our individuals and patients working with physical and occupational therapists so we can restore their functioning, so they can do the daily activities and exercises that are critical for their physical well-being and their psychological well-being. And lastly, we work on all the strategies I mentioned before, cultivating well-being and trying to help people become survivors, good copers in dealing with chronic pain. So here are a few take-home points for you. If you have chronic pain problem, you know a loved one or a friend that does, these are some things to think about that are very important. Focus on what you can control. Oftentimes it's very difficult to put your life on hold and wait for the pain to go away, because oftentimes it can get better but not completely better. So focus on what you can control every day. Next, keep moving. Do not allow the pain to interfere. If some exercises work, find new ones. If physical therapy has made things worse, start a new program. Keep searching, keep moving, keep your range of motion and your vitality. Another thing is that most people that struggle with chronic pain oftentimes brood about what they've lost, their physical comfort, or worry about their future. It's very important to learn to think less and stop and smell the roses. I find that individuals with chronic pain that learn how to live in the moment, make the best of each day possible, improve the day, do better. Keep growing as a person. Don't put your life on hold because of chronic pain. We always say that the best way to deal with loss is to keep growing. And also understand that hurt from chronic pain does not always mean harm or danger. Oftentimes, a person with chronic pain can do a lot more than they think they can. They just need the proper guidance to gain that self-confidence. And lastly, fill your daily life with purpose. As we all know, a purposeful life, helping others, having something to get up to do every day, having goals, can help you be more resilient and help you live a better life, even if you hurt really bad, severely bad with chronic pain every day. So thank you very much. And I hope my thoughts and my recommendations will be of help to you or to a loved one in dealing with chronic pain. Thank you.
you.